The Delta variant is responsible for around 82% of new COVID-19 cases in the United States due to how easily it can be transmitted. A new internal CDC report shows that the variant might be more likely to spread than the other variants, and some scientists are claiming that it may be more transmissible in large gatherings amongst the fully vaccinated than previously thought. A growing number of businesses, including Walmart, Sam's Club and Target, are planning to require employees to wear masks once again. Plus, many cities are also reinstating mask mandates regardless of vaccination status, including New Orleans, Washington, D.C. and Atlanta. Getting vaccinated is the most important way to prevent COVID-19, but masks also play a key role. The CDC recommended that fully vaccinated people start wearing masks last week after the agency confirmed an increasing number of rare breakthrough cases due to the Delta variant in people who had already received the vaccine. This mainly applies to areas with higher transmission rates, which also tends to coincide with low vaccination rates. We know that you have to be more meticulous with your mask when you're talking about a more contagious variant, says Amesh Adalja, a physician and senior scholar at the John Hopkins Center for Health Security. Over 400 COVID-19 cases were reported in Barnstable County, MA after several large public events, with 346 of those cases were in fully vaccinated persons. Being vaccinated still greatly reduces the chance of hospitalization or death from COVID-19, but masks are another key tool to help prevent the spread of the Delta variant, which is nearly twice as contagious. The CDC's changing mask guidance has been confusing for many people. A lot of the public is getting tired of trying to pass the messaging. And we do need to be clear and probably relatively simple about it, says Ezekiel Emanuel, a physician and professor at UPenn and advisor to President Biden on the COVID-19 response. He says it would be much simpler if the recommendation was that everyone, regardless of the rate of transmission in their particular geographic area, should wear a mask when going to crowded indoor places like the grocery store or pharmacy. We know that it's transmissible, and we know it's transmissible to people who've been vaccinated, he says. The SARS CoV-2 virus can be transmitted through the air in droplets and particles that can infect others with COVID-19. Research from the CDC showed that wearing these multi-layered masks keeps around 95% of aerosols that may be infected from spreading. They should be tightly fitting and should cover your nose and mouth, says Adalja. Doing so keeps infected aerosols from getting in or out of the mask. He also recommends, for the best results, it would be best to look for a mask that has a nose wire to improve the way it fits towards the top of the mask, keeping air from exiting and entering the mask.